Public health facilities are not only a major source of critical healthcare interventions, but they also consume a significant amount of healthcare resources. One of the most crucial predictors of public health facility success is the healthcare purchasing arrangements, and specifically the mechanisms utilized to finance their operations. The Strategic Purchasing for Primary Healthcare SP4PHC project was initiated to improve how governments purchase primary healthcare services with a focus on family planning and maternal, newborn and child health.
The health financing landscape in Kenya is characterized by a series of healthcare financing reforms. The most recent of these is the introduction of the free maternity service in Kenya and the removal of user fees at level 2 and 3 facilities. Purchasing is strategic if decisions about the allocation of funds is based on information about provider behavior and population health needs in order to maximize health system goals.
Kenya has been on a journey on UHC, and we know that health financing is very critical on that journey, very critical towards UHC. Therefore, looking at the overall financing landscape and defining where we want to go has been one of the critical areas. We still do have a few areas of bottlenecks. For example, when we look at the insurance coverage, it's still quite low at around 19%, with private sector insurance taking around 2%. And as we move to UHC, this is one of the areas that the government want to address.
Quality of care is one of the tenets of universal health coverage. And as the country tries to strive to achieve universal health coverage, then we need to consider about, what is the quality of care that we are providing within our facilities. And that's why ThinkWell came up with this project to try and see, yes, in as much as we are aiming to make sure everyone accesses services, how do we even, first of all, define quality in Kenya? How can we leverage on a component of health financing, which we are calling purchasing, to make sure that we deliver on better quality care?
Counties have a lot of data in terms of health service delivery, and so we are looking at how we could utilize the data available and the tools that are available. The Kenya Quality Model of Health will be looking at how we can utilize this to then link that to strategic purchasing, and this could be in at NHIF level to see how we reimburse for services that are offered at the facility level. As a result of the Linda Mama reimbursements, do we have improved maternal health care? So these are some of the parameters that we're looking to answer in our quality capstone.
Generally, we have systems that can be leveraged to link purchasing to quality, but we need to operationalize them. We need to move from wanting to do new things to using what we already have to improve the quality of care within the country.
ThinkWell became that necessary link between the NHIF office and the health department. That link was actually missing because those meetings were hardly there. Through those meetings, we've been able to do something. The county government must now move from sitting down for meetings and doing the real thing.
We need to ensure that the application of PFM rules and regulations do not obstruct the shared vision of the country in making sure that all people can access quality health services without having to suffer financial hardship. And that's what this program is raising a voice on, both for national government and county governments in the country.